Again, hello, good afternoon from Haier Biomedical headquarters here in Qingdao, China, and welcome to today's launch of our latest solutions for the last mile health. Developed by the team, and that's led by Enrique Wong, and you will hear more from the inspirational team a little later today. I will introduce Enrique, another speaker, Dr. Chetty, and the team in a little while as we move through the webinar. My name is Peter Peterson. I'm the Director of International Business Operations and Marketing Departments, and I'm also your host today. Just before we jump into today's overview, I want to give you all a little bit more what we're going to expect from today and a little bit more of a brief overview and the background of Haier Biomedical. And Haier Biomedical is obviously part of the greater Haier group. So I'm going to give you a little bit of a background of that information. Okay, the Haier group is the global #1 manufacturer of household appliances as per the Euromonitor for the past 13 consecutive years. The household appliance division produces and sells around 20 million refrigerator and freezer units per annum globally. So globally, we are #1 in this sector. Our strength is obviously our refrigeration history over 30 years. Haier, through its globalization efforts, now has a coverage on each continent with GE appliances from America, Aqua from Asia, Candy from the EU, Fisher & Paykel from Oceania, as well as our major expansion at home here in China with Leader and Kasati. The group's turnover is also in excess of 40 billion USD. Okay, so that's a little bit of a brief overview on the greater Haier group. So how does Haier Biomedical fit into the group, and then what is our competitive advantage? We're a global top 3 medical cold storage solution provider. We supply the full temperature coverage and the full portfolio coverage from conventional refrigerator and freezer, ice-lined, solar direct-drive vaccine refrigerator, walk-in cold rooms, and automated storage systems, just to name a few. That most of them also have ULC and PQS global certifications. As the industry leader and IoT pioneer in our industry sector, Haier Biomedical provides solutions for biological sample, medicine, blood, and vaccination management. This includes quarters, so just bear with us. We'll move through as quickly as possible. I'm not too sure where I dropped out, but I was just saying that it's important that you follow or scan the LinkedIn code there, and they'll help you follow us on a weekly basis on our social media platforms to ensure you're being kept up to date with the latest and greatest products from Haier Biomedical. And obviously, as the leading IoT solutions provider, you can also go to our website, which is www.haiermedical.com, and see all our products, team members' contacts, and even do a virtual tour of our exhibition center here in Qingdao. But today's about Hiclinic. And how did this idea for the last mile solutions come about? The team and the greater team that you guys have a lot of contact with here from headquarters and around the world has been traveling across 30 countries for the last 5 years, not only to cities, but also visiting villages and actually witnessed health solutions that are not really accessible, especially in rural or remote areas. Through cooperation with NGOs, Haier Biomedical has introduced the vaccine cold chain solutions to more than 70 countries around the world in this time over the last 5 years. We are in constant communication with end users in these countries. We know from these visits and speaking with end users that the vaccine cold chain is only partial in most locations and does not really cover the local health demand and or need. With this deep communication with our partners around the world has given us the knowledge that more solutions are urgently needed to push the healthcare programs to the last mile, hence why today is most important. And obviously with COVID-19 pandemic, this has made the need even more urgent. Therefore, this year, Enrique and his team have designed a set of solutions to lead the health solutions accessibility even to the last mile. Haier Biomedical covers the solutions to overcome these challenges in the field of primary healthcare, disease control, cold chain, and blood collection. All these solutions will be under the same banner of Hiclinic. In the design of these solutions, we have taken into account factors as professionalism, the environment, convenience, accessibility, as well as cost-friendly. And of course, the UN's Sustainable Development Strategy has been a major part of the design and the reasons why we've come up with these particular products and solutions. Hiclinic can be divided into two categories. One is integrated, containerized, and the other is mobile. Again, that was a quick overview. You're going to learn a lot more today from the greater team. Okay, I'm now going to move on to one of our speakers today. So I'm going to shortly introduce Dr. Shivanchetti. He'll deliver an overview and background for the demand of the last mile healthcare, followed by Enrique Wong with last mile healthcare solution. Then later, the HQ team will discuss in more detail some case studies related to the last mile healthcare latest solutions from the Haier Biomedical team, including HaierCare, LabReach 360, and CoolCube. I will introduce the team later as we move forward. There's also going to be two Q&A opportunities today. The first one, I'll be just asking a few questions to Dr. Shivanchetti, and then at the end, we'll take some questions for the greater team. So please email your questions now and/or send them into the box below for messages, and that'll help us come up with the questions to ask Dr. Shivan and then ask the greater team as we move through as well. So that's a little bit of a snapshot today, okay? I would now like to officially introduce Dr. Shivanchetti. He's a multidisciplinary scientist working across sectors, linking biomedical product development, industry, government, and NGOs to deliver solutions across the spectrum of scientific innovation. Applying his experiences to low to middle income countries, well, put it this way, last mile product development areas, he has worked to align systematic nodes to accelerate portfolios of market relevance for products and services as part of his remit. In South Africa, Dr. Shivan works as the Director of the Biomedical Industrialization and Globalization Program, which seeks to assist last mile product development, implement innovation based on products, technologies, and systems to meet unmedical needs. He serves on the National Advisory Committee for Innovation for the Department of Science and Technology and has represented South Africa at BRICS meetings and projects. So we're going to hand over to Dr. Chetty, and we'll let Doctor tell us a little bit more about his background and last mile solutions.
Hi, thank you, Peter. Thanks for that lovely introduction and the scope of the work that we're doing. So thanks to all the guests as well for joining us today. And the first thing we have to speak about is people. And the first thing we have to speak about is the people that we represent, and who we represent is the last mile healthcare. Sorry, can you all hear me and have the video closed clearly?
We could hear you clearly, Dr. Chetty, so please continue. Thank you.
All right. So the two groups of people I have to acknowledge first are our last mile community. People that live under $20 to $30 a day, sometimes even less. We have worked for the last mile person, and we have worked for understanding their journey and understanding their commitment to their lives and what healthcare means to them. And often for people living in these types of settings, healthcare is a secondary objective. Healthcare is something that is, if you can access, if you can acknowledge, if you can reach, it is there for you. Very frequently, there is the choice that you have to make, whether you take public transport, go to work, miss the healthcare day that you've acknowledged for yourself, and then you miss the space for that. So that is the patient journey. And everything that we do at the moment is about the patient journey. And the patient journey for patients in low to middle income countries is very, very different from people in provided first world tertiary countries. And this is something that we've seen over the last 3 to 4 weeks, which has changed. because the mandate over the last 6 months is that we are not safe until everyone is safe. So if you can vaccinate in a first world country 100% or 99% of your population, it does not mean that you are safe from disease. And this is something we realized in South Africa a very long time ago, maybe about 15 years ago, because we've had pandemics, we've had epidemics, we've had HIV, we've had TB. And in addition to it being a public health burden, it's also made South Africa a primary focal point for global healthcare. In terms of low to middle income countries, we have the complete infrastructure for biomedical product development, biomedical innovation. Plus we have the communities which are there. So working with Haier Biomedical in the last 6 months became a priority for me as we look to create joint global partners under fundamental systems to achieve these aims. So over the last 6 months, we've worked intensively with Haier Biomedical to expand the portfolio offering. We've worked under the technology perspective of delivering products that are very technology aligned. We've worked on systems and designs perspective. And the second group of people, apart from the last mile healthcare people that I have to speak about, is the team. Because over the last 6 months, the team has worked extensively across cultures, across boundaries, across understandings, and they've really pushed maybe 3 to 4 years work in the last 6 months. So particularly to the leadership of Enrique and the executive of Haier Biomedical, thank you for engaging in this initiative. And primarily to Will Zhang, we are thankful for his work and his diligence, because without him this would not be possible today. So I will now continue with the presentation, and we'll speak about pandemics. And we've had warnings continuously for the last 100 years. We have not focused on disease as a species. We focused as a disease as something that certain populations have that cannot affect us, and COVID has shown us differently. And the warnings we've had are Ebola, Zika, and we don't have SARS and MERS on here. We don't have MDR, XDR, TB. We don't have chronic HIV infection, but these are real world problems in South Africa that we've dealt with. And over COVID-19, the world has gotten to understood what it means to have people in your society dying. These are real world issues we faced all the way from the early 2000s in South Africa, where large percentages of our population were dying from HIV, and then TB, and then the dual epidemic. And what we've gained to understand is that's all about the patient journey, controlling, surveillance, supporting these people, supporting ourselves, because regardless of your financial status, regardless which country you sit in the world, the mandate is now we need to take care of everybody. So we're on to this last mile healthcare initiative. We have the committed global partners and people, and we have the quality of products that roll out, the social initiatives to be able to achieve this and at least try to prevent future epidemics from happening. And hopefully whatever we miss will not be as severe as COVID, which stops the entire world from working. So our mandate is now to provide this front line of healthcare through infrastructure, through best practice, through supportive systems, through donor funding to achieve this. So we'll now go on to the next slide, please. So immunization has been a leading topic over the last 2 years. It's been a fundamental technology shift in our civilization that we have been able to develop a vaccine in such a short time. One of the reasons for this is because the problem, the COVID virus and the COVID pandemic was a global problem. Everyone had to come together to deliver a vaccine. Technology had to be pushed. But we've had disease for numerous years, and there will be disease after COVID. Vaccination does not only include immunization for infectious disease. Disease extends to a point of view of non-communicable disease as well. In Africa, for example, by 2030, cancer and non-communicable diseases are the leading killer by 2030. So immunization, vaccination needs to be against all diseases. COVID merely provides a platform to show what immunological protection can achieve if you provide this to all people. And vaccination rates in Africa from basically, I'll go back a few steps and mention what I discussed. In terms of immunization, immunization is not just for COVID and infectious disease. Immunization is a barrier to disease. By 2030, non-communicable diseases, cancer, diabetes, cardiovascular disease are the leading killer in Africa. So these types of immunization programs and looking at immunization as eradication strategies for disease extend past infectious disease. And what we need to do is establish a mandate where per a certain finite amount of population, there is a vaccination station, or there is vaccination access and rapid supply chain access based on the diagnostics that we are finding. This is the front line that we are creating. That needs to be where the efforts are made. And even though we've had COVID, there are some very, very, very good stories. For example, the malaria vaccine that's coming out, we've struggled with malaria for a number of years, but it seems like the technology that's developed over COVID, the systems, the support may eradicate malaria. So we're very confident in malaria and then TB and then HIV. Whilst COVID is what we're dealing with at the moment, there's been 50 to 100 years for some of the diseases that we haven't been able to eliminate. And COVID is our lesson to design the systems to take care of this. So next slide, please. The next system that we set up is blood supply. We discussed what the blood donation, blood supply, discussed what the critical realities of having chronic illness treatment, critical surgeries, traumatic injuries, and cancer treatment mean for this population. And they will encumber disease at a very high level if the lifestyle is changing. So blood donation in combination with types of traumatic injury, in combination with motor vehicle accidents, in combination with global disasters, geographical disasters, natural disasters. We need to be able to provide a type of frontline for blood supply as well. And South Africa, we have a very good blood supply service, the South African National Blood Services. They run very good campaigns, mobile clinics, mobile vans, diagnostics, and pulling in this type of blood bank supply. So through Africa, through South Africa, we can grab these partners. We can get these partners to support us in our rollout and support us in this global rollout. Through the international partners, we can get partners to support these initiatives. But these functionary structures of diagnostics, testing, blood donation, clinical access, medical rollout, this frontline of rollout is very important. So we've been comprehensive in what people need, and blood supply is definitely one of those. So next slide, please, Peter. Yeah, and now we go into an age where we need more blood supply. Africa is expanding. There's more growth. There's non-communicable diseases, and there's often a lack of information around blood supply, medicine, and how the individual, regardless of their social income bracket, regardless of where they fit in the working sphere, what their patient access is, to deliver a community type initiative towards what healthcare is. And in South Africa, we have very, very strong blood donation services, organ donation services, and all of this relies on a social responsibility of people to be able to donate blood, so that when other people need it, donate organs so that when other people need it, this is accessible, and we can access that. So for low to middle income countries, we're going to increase that pie chart slice. We're going to increase that pie chart slice to include low to middle income countries and get these blood units and get these blood donations through that, through our systems and design. So next slide, please, Peter. Okay, we want to back to Peter, who will introduce Enrique. And Enrique will speak about the cold chain and the leadership that he has provided over the last 6 months. And I thank you for your listening to my presentation. And later on in the presentation, I will be back to answer some questions. Thank you.
Thank you, Dr. Chetty, for that in-depth overview and background for the demand of last mile healthcare. And so, yes, you're not off the hook yet. You'll be back in a little while to answer some of my questions that have come up from the attendees, as well as one that I might have for myself. So now, thank you again. So now I'd like to introduce you to my colleague and friend, Mr. Enrique Wong, who is going to take us to the next journey today and introduce you to the High Biomedical's last mile healthcare solutions. Enrique is project director at High Biomedical, and he oversees the African market and UN and other NGO projects across emerging economies. Enrique is a globally recognized project management professional with over 10 years of experience in the vaccine, cold chain, and medical equipment industry. From 2016 to 2021, Enrique introduced the vaccine cold chain solution to more than 25 countries under the expanded program of immunization system through the Gavi CCOP platform. He leads the sales and R&D brand development team for High Biomedical's vaccine cold chain solution, and he has taken with his team the company to the world #2 in this particular area and sector in the last 5 years. So without further ado, with a big smile on his face after a little nice intro I gave about the man, I'm going to hand over to Enrique to take you to the next part of the webinar.
Thank you very much, Peter, for the introduction. And also thank you, Dr. Shivan, for sharing the global background of the urgent demand of solutions for primary healthcare, disease control, and blood shortage in the last mile. Actually, we have traveled to more than 30 countries, as Peter had mentioned, in the last 5 years, not only in cities, but also in the villages and rural areas. And we actually witnessed that the health solutions are not really accessible in these areas, and especially in the rural and the very remote areas. However, if we summarize the influencing factors we have seen, we can roughly divide them into the following challenges. For example, limited or no access to power supply, or they're still using the off-grid power, or lacking of health facilities within reach, or lacking necessary services in health facilities. Some of the health facilities, they're also in shortage of equipment or in shortage of professional staff. So the final result is that they're lacking of professional solutions to overcome the above challenges. So if we can clearly understand the challenges faced by these regions, we will easily put forward the target last mile health solution. In the past 10 years, for vaccine cold chain solutions, we have cooperated with the NGOs globally, and we already introduced them to more than 70 countries around the world. However, in the constant communication with the users in these countries, we know that vaccine cold chain is only partial of the solution they need to cover the health demand. So they still need more than we imagine. And after such kind of a deep communication that gives us the knowledge that there are still a lot of areas we need to dig, and we need to set up our solutions to push the health program to the last mile. And this becomes more urgent after the COVID-19 pandemic. Therefore, this year we have designed a set of a solution to lead the health solutions accessible even in the last mile. It covers the solutions, as Peter had introduced, to overcome the challenges in the field of primary healthcare, disease control, cold chain, and blood collection. And all these solutions will be under the same banner of Hiclinic. And Hiclinic will be the future brand to cover these last mile solutions. And in the designing of the solutions, we're also taking into account factors such as professionalism, convenience, accessibility, as well as the cost-friendly, and the UN SDG Sustainable Development Strategy. Hiclinic can be generally divided into two categories. One is integrated, containerized, and the other is mobile. For example, for this page, you can see it covers integrated, containerized last mile health solution. For the primary health care, we have the solution of HaierCare. And the HaierCare, make example, it is such as solar clinic. It is used as the vaccination center, routine physical examination of pregnant women and children. And also it can provide the health water, publicity for vaccinations in the very remote areas where vaccination centers have not been set up. For disease control, we have a solution of a LabReach. So as the name mentioned, we can push the lab to last mile. For example, our solution has a solar lab. The solar lab is used for collecting, screening, and analysis of the infectious diseases samples in the remote areas. For cold chain solutions, I think most of the audience today, you know that we are professional cold chain supplier in the world. And also for the last mile cold chain solution, we have the CoolCube solution. For example, solar direct drive cold room, as well as the refrigeration van. And also for blood, we have the solution of 360, such as the Containerized blood collection center, and it is used for blood collection and donation, as well as storage in the remote areas, as well as cities and towns. For this page, you can easily see we also provide the whole solution for mobile last mile healthcare solution. For example, this is the two blue one. They are vaccination bus and a vaccination trailer. They are used for vaccinations in a city center or in remote areas where vaccination service has not been set up. And this is the PCR Live. This is the mobile clinic. They are used for COVID-19 sample collection and tests, as well as the other services. And here is the multi-operational clinic. They are used for multiple medical services, such as dental. And this is very clear that you can see this is a blood donation bus. They are used for blood collection and donation. Because of the time limit, I will introduce here. Maybe I cannot give you too much details here of Hiclinic last mile health solution. But later on, we have 4 more colleagues, and they can give you more details and the case studies for each solution. I hope our audience today can get the information you need, and we also welcome deeper discussion after so that our other colleagues can deeper introduce the Hiclinic solutions.
Thank you, Peter. Thank you, Enrique. And yes, we clearly have some major challenges, but due to you and your team and all the hard work, we have the solutions to overcome these challenges. So thanks for your overview. And as Enrique said, we have the opportunity to contact our different team members that you currently know. And if you don't know them, please reach out and you better find out more details in depth about today's webinar. Before we move on, can we just ensure, please, that you keep your microphones on mute? We'd really much appreciate that if possible. So we're now going to move over to the first case study, and this will be delivered by Will Zhang, Regional Sales Director for our Hiclinic solution HaierCare immunization program. So over to you, Will, and to continue the webinar. Thank you.
Thank you, Peter. Dear friends, it's exciting to share the HaierCare series with you here. This series focuses on primary healthcare clinic and the Hiclinic brand. We call it immunization program because they are widely used as a vaccination facility in this pandemic. However, they can also work as primary clinic in normal days to provide functions like routine body check, IVD test, drug prescription, etc. First, let's review the implication of the clinic for primary healthcare. Say the challenge in the last mile. Primary healthcare, or PHC, is the front door of the healthcare system and provides the foundation for strengthening the essential public health functions to confront public health crises such as COVID-19, Ebola. So primary clinic is a castle in the last mile. To realize the WHO and UNICEF vision in the 21st century, that is universal health coverage, and the third sustainable development goal, that is good health and well-being. Primary clinics are irreplaceable in providing accessible and equitable health care, especially for people in rural and remote communities. In these areas, they may face conditions like primary facilities far away, shortage of facilities, a shortage of health workers, available facilities under disrepair, bad electricity supply, or off-grid. Then what can be done to strengthen the PHC? Let's see a case study from WHO. It introduced a flexible and convenient facility put into use, the mobile clinic. This happens in Shivanchetti district, a mountainous area in the east of Azerbaijan. Is home to about 106,000 people, most of whom live in rural settings. Accessing healthcare is difficult for many, owing to inadequate primary healthcare facilities. A pilot project in Shivanchetti is going on, which is focused on training health workers and empowering communities. The highlight in this program is the use of mobile clinic. In a small town, they invested 3 mobile clinics, which are vehicles that move from village to village, carrying medical equipment, supplies, and community health workers. They ensure that healthcare is brought closer to those who can't travel to health facilities far away. People will get their health checked, health service will be easily accessible, and people will be enlightened about their health issues. For Azerbaijan, the results and lessons learned will have a strong impact on building the primary healthcare foundation of the country. So this case describes a typical scenario of mobile clinic, a vehicle with a container or trailer transformed to a clinic and drive to wherever needed. This is useful in regions that are lack of PHC facilities and far away from the health center. Besides, sometimes the region may need a permanent facility, but lack of manpower. Based on our understanding of the different scenarios and purpose, we have designed 3 solutions in the Hiclinic package for customer to choose from. Let's see the first one, solar power clinic, the prefabricated type clinic. Prefabricated solar power clinic aims to improve the primary health condition in resource-limited environment. Is featured with reasonable and affordable price, easy constructions and removable, and a long-last life cycle. Is constituted by several basic parts. clinic cabin made by prefabricated flat packing panels or by reshipped containers. Power system. They use photovoltaic solar panels to convert solar energy into electric energy. Water system include water supply, purification, drainage. Security system includes CCTV, anti-theft measurements, internet connection, and IoT fittings. Cold chain equipment, furnitures like hospital beds, medicine shelves, and first aid kit, etc. Besides these basic fittings, more are optional and able to provide different functions upon the user need. The second solution, containerized type clinic. We also call it containerized mobile clinic, vaccination shelter, or other similar name as per medical purpose. This solution reships shipping containers designed with clinic functions. Need to mention that the transportation of this clinic is more convenient as a standardized 20 feet or 40 feet container. In 2021, this kind of facility has a lot of application against COVID-19. Internally, vaccines are stored in higher solar-powered or mass-powered refrigerator. Equipped with intelligent HaierClinic monitoring system covering each operation area, it can provide a real-time supervision and inspection of the whole vaccination process. It's also expandable in scale by combining 2 or more containers to form a health center. Thus, it's a good choice to establish in places like refugee camp, temporary gathering place, rural and remote areas. The third solution is a mobile clinic or vaccination vehicle. This is exactly the same type of solution as mentioned in the WHO case study. It goes further by providing a comprehensive HaierClinic monitoring system. The vehicle can be a bus, van, or trailer, size variable, function area, and layout all be customized. This mobile platform extends its coverage and improves accessibility of medical service. People from remote mountainous and rural areas and disaster-hit areas can benefit. This is a summary list of products fitted to the clinics. We equip them with WHO PQS qualified products made by Haier. For example, SDD refrigerator and freezer, long hold over time, vaccine cold box and all vaccine carrier, remote monitoring devices. Some outsourced products like Doppler ultrasound instrument, mobile ECG, safety box, etc. Now, this is an extension of HaierClinic to PSA, medical oxygen plant. PSA means pressure swing absorption. Some countries are promoting medical oxygen to the last mile. China has begun planning to build PSA oxygen plant in some township hospitals to ensure oxygen accessibility. With our strong partner, the factory, we have quoted to countries like Liberia, Cameroon, and Kenya for international supported programs. Medical oxygen system include skid-mounted or containerized, split system, or integrated mono system. All of these will be available with ensured quality and delivery time. Okay, above is my sharing for the HaierCare solution. Thanks from you hereafter for further communication.
Thank you, Will. And out of our senior regional directors, whose case study LabReach will focus on disease research and hard to reach areas. So over to you for case study number 2, Yang.
Okay, thank you, Peter. Thank you, Will, for your presentation. My name is Yang. So I feel so pleasure to introduce you the Hiclinic LabReach solution. So both of us know well, if we would like to realize a better life for everywhere we live, the equal and reliable healthcare is necessary. For increasing emerging economy countries' population life expectancy, we should improve the first emergency response, accelerate the health facility, and diagnose improvement for disease research and testing areas hard to reach. Despite considerable investment in infrastructure and resources by many emerging economies governments, offering consistent and timely supplies of medical tests to people in the last mile is still a challenge. In many parts of these countries, this means patients cannot get health tests and medical treatment from their closest health clinic because of lack of diagnosed equipment, life-saving devices, and less stock or expired medicines. So the Hiclinic LabReach for last mile is an organized and systematic distribution system that aims to make sure medical test services are delivered to places that people who need them can reach. With Hiclinic LabReach solution, it can be used in more than 56 countries by more than 20 different kinds of health tests and medical diagnosis. The minimum waiting time could be reduced to 15 minutes, which can serve more than 95% population, especially for children, rural and refugee people. So the COVID-19 pandemic has changed the way health workers across the globe. But at the meantime, it's more about exposing problems that we ignore on a daily basis, such as for those in the lab are seeing rapid changes to their work environment, and not just the high number of requests for emergency medical tests. Because for rural areas, emerging economy countries, there's no enough test facilities and kits, and more professional epidemic provision and control measures is needed. But in short term, to build such health facilities is unpractical, and it is a great expense for government. So can we realize the last mile medical test, especially in COVID-19 epidemic period? The Hiclinic LabReach can give you an idea for last mile medical test. In Hiclinic LabReach solution, we have several types of mobile laboratories and different kind of power supply. Now let us see a case study using mobile medical laboratory truck in South Africa. This mobile medical laboratory is driving through South Africa, operated by National Health Laboratory Service. The tests performed at the mobile medical lab include HIV rapid test, TB, complete blood count, cholesterol, blood glucose, liver functions, urea, and electrolytes. As per statistical data reported, this mobile medical laboratory is boosting access to quality diagnostic testing for patients in remote areas of South Africa, while slashing turnaround times and the carrier cost. So the tested results that often takes to several days are now available to clinicians in just 1 to 12 hours. In a 4-4 period, the lab processed more than 2,900 specimens. That number is expected to increase as the network of carriers expands. The key to this success is that the mobile lab brings high complexity clinical laboratory testing directly to the remote area. This shortens the waiting times for results and reduces the cost and the time involved in having carriers transport specimens to the region's reference laboratory. So from this case study, we can understand that it performs the high complexity testing and may provide us a new model for diagnostic testing for other developing countries. The Hiclinic LabReach can be considered as an extension of hospital laboratory service at the last mile. The specimens are sent to the mobile laboratory from the health facilities in the surrounding area. And secondly, there is a considerable effect on the quality of the samples and the accuracy of the diagnosis. If the specimen's transport time is several days or weeks, especially for the patients, this will be a hard period to wait their results anxiously. With the mobile laboratory, it can perform detailed TB and HIV testing within a short period of time. This helps healthcare workers start counseling and treatment immediately, thus restricting the further infection of the healthy patients. And now let us see together another Hiclinic LabReach solution named the Solar Powered Laboratory. So the short name is SPL. It has 3 different kinds of form depending on users' requirement and technical background. The first one is what we are seeing in the picture, the prefabricated steel structure laboratory with solar system. The advantage is that for the users, they will not need to construct the laboratory facility. All electric and water system has been pre-installed in the laboratory, easy for international and in-country transport. In addition, the laboratory is supplied by solar system. It is very suitable for unstable or available city grid areas. Inside this laboratory, it could be personalized for working zone number and layout. So actually, we are working with Institute Pasteur of Dhaka for this kind of solar lab. And the second laboratory of Hiclinic LabReach is containerized. So containerized mobile PCR laboratory. This can be another economical solution which has mobility, quick construction of full functionality, high throughput testing system, such as sufficient space for laboratory operation. The containerized laboratory is applicable to hospitals, third-party testing companies, ports, CTC. In addition to the on-site detection of pathogenic nucleic acid, it can also be used for emergency biological detection, providing a mobile, fast, safe, accurate, and efficient technical inspection platform for emergencies and public health events. Depending on PCR operation, the laboratory is separated by 3 main zones under negative pressure, such as the reagent preparation zone, sample treatment zone, and amplification zone. For all operations, it has each circulation flow for sample, reagent, and health workers, which need be respected. Once the user received at the local site, they need only to plug on the power for quick use. Actually, our Hiclinic containerized PCR laboratories for more than 5 units are using in north and south of Indonesia for COVID-19 test requirements. And besides the laboratory, of course, we can also supply you all equipment and region to be used in the PCR laboratory, from the sample collect to the sample test and the storage. And also, we can see, and also such as consumable products, such as different kinds of microplate and pipettes, etc. So if you have such requirements, you can contact us for further technical assistance. We hope that our Hiclinic LabReach can assist the global last mile health development. Thanks, everyone.
Thank you, Jan, and again, thank you to Will. We've just heard from two of our regional sales directors. We've just gone through a lot of information was covered by both of them, and I'm sure our friends attending today will want to know more. And of course, you can contact us and other members of the team after today's event. And again, you can go to www.HaierMedical.com. So I'm now going to come back to you, Dr. Chetty, and I've got a couple of questions that have come in. Well, actually, I've got 3 questions that have come in to today that I want to ask you. So are you available? Are you ready, Dr. Chetty?
Yes. I'm ready.
Okay.
Yeah, let's see what type of questions we get.
We'll see what we've come up with, and I want to thank the attendees for providing the questions as well. So, first question: what, in your opinion, are the biggest challenges facing last mile healthcare, and how do we overcome these?
Okay, that's quite a broad question, but major challenges I would think is lack of knowledge. Sometimes lack of knowledge and coordination is a large challenge, because we work for the people in last mile healthcare, but we also work for the decision makers. And the decision makers need to know what types of information that can be trusted, what types of information are correct. And that's a primary focus of what I think the challenges are. So we've tried between our networks to alleviate and assist people. And if there's more information required, people are welcome to contact me, and I can assist. But to answer the question, I think what we require is comprehensive and continuously improving processes that link and lead healthcare workers, municipalities, Ministry of Health, private stakeholders directly with best technologies, practices, and education. So a very, very comprehensive type of understanding of healthcare. I also think that technology adoption for low to middle income countries in the 4th industrial revolution can alleviate the sort of long-standing healthcare bottlenecks. So the IoT type of concept is something that Haier is familiar with, and the AI machine learning sphere, as well as improved molecular diagnostics and genetic testing, can allow low to middle income countries to implement population surveillance, thereby preempting disease and decreasing costs. In areas where electricity and access are a challenge, we've had some questions about that, where there are no roads and where there are electricities. The solar and mobile infrastructure can overcome these hurdles. So I think that these are the fundamental take-home messages from what are the biggest challenges and how do we overcome these. And yeah, hope that answers the question.
Thank you. I'll just get you to mute when I ask you the question. That's okay. This next question is actually from me, and then we've got one more that's come in from attendees today. So the next question is, what is the major function of your academic division, and how does it contribute to last mile initiatives such as Haier Biomedical's Hiclinic?
Okay. At the Biomedical Industrialization and Globalization Division at Woods Health Consortium, I work on low to middle income country healthcare delivery systems and design the global supportive partnerships for these. Both the product development and fundraising are areas that we target to put together projects for scalable global rollout. Our interest in Hiclinic began when we required an infrastructure manufacturing partner for our lead project, Frontline Global. Frontline Global is a project that aims to provide comprehensive knowledge-based best practice for last mile systems for low to middle income countries, beginning with Africa, but we're also working in South America and Southeast Asia. This is based on South Africa being one of these leading low to middle income countries with both technology and the rural population. Together with our multi-sectorial and multinational partners, we have put together social impact initiatives to create a global last mile frontline against current and impending disease burdens for low to middle income countries. We will launch this initiative in the next few weeks as we get the global partners together. But you're very welcome to view our website, which we will launch, which will be www.frontlineglobal.org, with a hyphen between the frontline and global. So hope you have a bit more of an understanding of what my academic division does. HaierCare is one company that we work with, and we work with a number of the national partners and systems as we look to connect the people that are willing to make a difference, that are committed. So thank you.
Thank you, Dr. Chetty.
Next question is a bit easier, Peter.
The next question is a bit longer, but
okay.
as I've mentioned a couple of times, if there's people want more information from you or the Haier Biomedical team, obviously they can reach out and we can get back to them at a later date, because we only have a certain amount of time today to ask questions. So this one's a bit longer. So if you need me to do it again, just let me know. But my last question in this segment is, what type of systems and design do you think will lead to systemic improvements in low and middle income countries' last mile healthcare? And how does the Hiclinic portfolio contribute to this?
All right, just one more time, Peter.
Okay, so I'll do it's kind of in two parts, so bear with me. What type of systems and design do you think will lead to systemic improvements in low and middle income countries' last mile healthcare? Part one. And part two, how does the Hiclinic portfolio contribute to this?
Okay. So my background is actually in vaccinology, medical biotechnology, complex systems of biology. So I transitioned in the last 3 or 4 years to systems designed for actual healthcare implementation, while maintaining portfolios in vaccinology and these types of in-depth sciences. So my major function is sort of systems and design. So from my understanding of systems and design, we require effective knowledge leadership, financial administration, global partnerships, and fundraising in order to roll out and continuously improve last mile healthcare. And we have a number of local structures in South Africa that I work with and support this. So through Wits University and the Faculty of Health Sciences, we have access to one of the leading low to middle income country knowledge hubs for resource limited healthcare, probably the biggest in Africa. Through Wits Health Consortium, one of the leading nonprofit companies, we have leading international financial management for grant and donor funding, which is something valuable when you consider WHO, UN type grants coming into Africa. And through leading African genetics and clinical management partners, we have best practice in educational programs to support end users. We don't want to put in terminal infrastructure without the proper associated support packages for these units. Because the quality of the unit or the quality of whatever we put down only depends on what type of knowledge, what type of support, what type of long-term support we are providing the people with. To answer the second part, the Hiclinic portfolio contributes by being one of the most comprehensive and high quality infrastructure packages, which competes heavily in several arenas. And these arenas are technology, flexibility, ease of use. Can they be the financing? Can they be the support? Can we make this an easy decision? Can we make it sustainable? So that's why I think the Hiclinic portfolio is something that's very attractive from a systems and design perspective. Also, the manufacturing capacity. I mean, in the last year or two, the factories that you've put up, and the global reach and networks that you have to deliver this at a rapid rate, install, and that's a great fit for the social impact initiatives we work on in the African side. So post-pandemic, frontline global and Haier Biomedical, I think this is a very good type of initiative. And yeah, that's it for my last question.
Thank you, Dr. Chetty. And you touched on some things that I probably should have talked about or may have dropped out at the beginning of the webinar, but you made a good point. Haier Biomedical has the capacity of over 200,000 units a year right now on our 50,000 square meter, over 2 floors manufacturing plant here in Qingdao. However, we started construction earlier this year on our 95,000 square meter site next door for our centrifuge factory, and other products will be moving to be manufactured, designed in the future. So our capacity is going to be made out. And thank you again, Dr. Chetty, for your questions. Now that's the end of part 1 of our Q&A. However, please keep sending your questions and the team will get back to you as soon as possible. And for further questions, we'll tackle them in Q&A part 2. Robin's ready, and now we will hear from Robin Xu, another one of our experienced team members, and as our regional project director, Robin's case study is CoolCube. He will provide you an overview of temperature-controlled transportation and storage solutions. So over to you, Robin.
Okay, thank you, Peter and Shivan. Hello, everyone, I'm Robin. Next, I will lead you to learn what challenges we are faced in vaccination logistics and our Hiclinic solutions to ensure the vaccine safety in the whole process. We call it CoolCube. So this picture shows the general vaccine flow and process from aspects of storage and transportation. So for vaccine storage, it can be sent at the highest national level, provincial level, district levels, as well as the lower health facility level. For transportation, there are quantities as well as last mile deliveries. So what challenges are we faced in vaccine flow and process? According to the data from the US CDC, improper vaccination error group, taking up to 57%. There is no doubt qualified cold chain equipment is vitally important, and the vaccines must be stored under cold chain equipment from manufacturer to administration. To achieve effective cold chain, QS team has issued related standards in several categories, and listed qualified manufacturer is among them, with full range products like cold rooms, on-grade vaccine refrigerator and freezer, solar direct drive vaccine refrigerator and freezer, refrigeration vehicles, temperature logger, RTMD, voltage regulator, and so on, to meet end users' all level needs in different vaccination scenarios. So let's come to the vaccine storage and high level first. The commonly used equipment is traditional on-grade cold room, and they can be found in national or regional medical stores. However, it has many problems. The operation costs are very high, and it has big daily consumptions in electricity as well as diesel. It has high dependency on power supply, and power fluctuation may lead to damage in parts or cold room failure. So frequent maintenance and replacements of spare parts are required. Meanwhile, as it has very short holdover time, there will be big risks for the vaccine stores inside if there are some accidents like power failure or long time maintenance and repairs. All of them will make you headache. To solve the problems met in traditional on-grid cold room, we have developed the solar direct dry cold rooms, and the WHO PQS standards has also been drafted for this. Have all your worries in the traditional cold room been solved by using solar direct dry cold room? Let's check it together. Haier solar direct dry cold room is solar direct driven without accessories like inverter and auxiliary batteries. All the refrigeration components are DC type. Its power supply is from solar energy with very low TCO, and there is no consumption in battery, fuel, electricity. Tens of thousands of US dollars can be saved. Similar with our SDD vaccine fridges, water tank technology is also adopted in our SDD cold room, contributing to its long holdover time, as long as over 100 hours. The safety of vaccines can be better secured in case of any accident. A multi-engine ensures best use of the solar power, and it is also compliant with the UN Sustainable Development Goals. With the remote monitoring components and devices used, we can achieve remote monitoring of internal temperature and the power supply, as well as remote control and diagnostics of the temperature controllers. You can see from this, all your worries in the past becomes no worries now. Our first pilot project of SDD cold rooms was launched in 2019. It was installed in National Vaccine Store in Abuja, Nigeria, for new technology introduction and field tests. To meet clients' needs, we have had some customized designs. So here lists some information of this SDD cold room we installed in Nigeria. Its performance and maintenance have been satisfactory. To be honest, the per cube price may be a little higher than traditional one, but you will know how much you could save and how many benefits you could get from our SDD cold room. You can see from the graph. Yeah. Besides vaccines, it can also be used for the storage of vegetables, fruits, and other farm products. And many more customers has procured our SD cold room after Nigeria, such as Burkina Faso and Chad. So from data provided by WHO, at least 33% of all vaccines are spoiled due to inadequate cold chain. Besides cold room and vaccine fridges, Biomedical also have refrigeration vehicles to further strengthen and ensure the safe storage and transportation of the vaccines across the complete cold chain. Our refrigeration track uses environment-friendly refrigerant R452A with low GWP, and it is expected to be WHO PQS certified in early 2022. It is able to work under 43-degree ambient temperature. It has backup diesel tank for cooling system and remote temperature monitoring system. Meanwhile, we could provide customized services for different requirements. And 17 units higher refrigeration tracks have been delivered to Uzbekistan, and we received very positive feedback from the end users. So now we have qualified equipment used in storage as well as transportation. What else shall we need in vaccine logistics? It is monitoring. Temperature monitoring equipment is a very important element in achieving effective cold chain and ensuring vaccine safety. So for fridges located in remote areas and scattered throughout your country, you could choose HaierCare RTMD, suitable for monitoring of single cold chain equipment in compliance with WHO PQS standards, with PQS code E006 numbering 60. The device is easy to operate and can upload data to the web portal automatically when powered on and connected to the internet. And for the high-level user administrators, they can monitor the equipment performance remotely on the web portal, including the location data, real-time and historical temperature data, and so on. Similar with our UQ RTMD, we can also provide the LoRa RTMD with one base unit and multiple smart sensors, more suitable for the monitoring of multiple cold chain equipment gathered together, and fridges in laboratories or cold rooms in national cold stores are very examples for the application of LoRa RTMD. So as a full-range temperature cold chain equipment supplier, we also provide -20-degree and -80-degree freezers for storage of different vaccines or biological samples. We have supplied those equipment to over 100 countries to support their campaign in fighting against the COVID. We are always on the way to develop better products and solutions for vaccine safeties. So that's all for the CoolCube, temperature-controlled transportation and storage solutions. So over back to Peter.
Thank you, Robin. Some very important points made there, especially with remote monitoring, which is a key part of the package that we can supply to ensure that you're monitoring your vaccines. And what the key point is in real time. And another key point that Robin made is that we are continuously innovating new technology in the support of the fight against COVID-19, as well as vaccine and cold chain solutions. So it's very important that we do get your feedback from your individual markets about different needs and requirements that are expected maybe from your governments or other areas in the private health sector. So again, as I mentioned earlier, any questions, please send them through. So now I'm going to hand over to our next speaker today, which is Ian Hu, our sales manager, and his case study is Red360, which will cover our extensive global leading blood collection solutions. So over to you, Ian, to tell us a little bit more about why our solutions here at Haier Biomedical solve the last mile collection need.
Thanks, Peter. And I'm also very grateful to be here today to speak for this Red360 blood collection solutions. So just back to the topic today. As Shivan has explained in the previous presentation, lack of whole blood or blood products is a serious problem in many countries. The main factors for this phenomena includes cultural barriers, lack of infrastructure, and lack of government support. The shortage of blood donation rate in emerging economies is more serious than in most developed countries. And for example, as we know that anemia is a condition from malaria, so it's supposed to have a higher blood donation rate to meet the demand in the countries where malaria is a common disease. But the fact is in an opposite way. I think everyone in this meeting understands how important the blood donation rate is. So from 2019, Haier Biomedical has started to engage into this field to find out a comprehensive solution that can support blood transfusion institutions to help their efficiency and basically make their life easier. And as of now, we have turned this idea into practice, and we aim to build a way that allows holding blood donation campaigns at the location where the road can reach. And by providing the best service to donors, then we can reduce the barriers to blood donation caused by lack of infrastructure and convenience. Therefore, finally minimizing the blood shortage within the community. In this Hiclinic proposal, we're going to present two ways of solving the mentioned issues. One of them is the mobile solution. We meant to create a facility that is suitable for areas with a dispersed population. The facility should also have a large service radius to conduct blood donation campaigns across cities, villages, and public areas. It should be able to integrate it with blood collection, testing, and transportation functions. The second solution in this Hiclinic proposal is a stationary facility that is able to hold long-term blood donation campaigns at a fixed place, but with a lower operational cost and easy to deploy. So in the mobile solution in this Hiclinic proposal, we'll be mainly focused on the blood collection bus. Before we go through the details, let me firstly introduce two stories that are reported by local news. So there's a small village in China called Shangjing in Hubei province. And in February this year, Hubei Provincial Blood Bank decided to deploy a blood collection bus to enhance the blood donation rate and therefore relieve the blood shortage in the area. And also in February, the bus made its first trip to this small and peaceful town. And up to August 5th, people participate in this unpaid blood donation events has reached an unbelievable 1,841 times and cumulatively achieved roughly 661,000 milliliters of whole blood. And on September 12th, one day, 86 people donate their blood and 33,000 millimeters has been collected. And before the blood collection bus has been deployed in the village, there were no blood donation campaigns ever happened in this area. So you can imagine how many lives has been saved by this facility. Another similar story happened in a village called Songjiang, and it's also in February this year. They deployed this blood collection bus, and with only 4 hours, the bus collected blood from 39 community residents who signed up for this voluntary blood donation, and 35 people successfully donate their blood. And that's just the first trial of deploying a blood collection bus in Songjiang district. There are a lot of similar stories of how this blood collection bus increased the local blood donation rate. So we really need to start working on the research in African market as well. Here are some basic parameters for blood collection bus. Depending on different service capacity requirements, we are able to develop a bus based on 12 meters, 10.5 meters, or 8 meters. That is an internal view of a 12-meter blood donation bus. It is equipped with the general blood collection equipment and suitable for 4 donors to conduct blood donation at the same time. It equips with higher biomedical vehicle-mounted blood bank refrigerator and active cooling transportation coolers that ensures the blood safety of long-period field work. In addition, this is a customization solution. The equipment integrated on the bus can be adjusted based on client's needs and can also be designed based on, the furniture's power type and cold chain management system can also be designed based on client's need. The next one is a stationary solution that we would like to introduce in this Hiclinic proposal. Is this solution basically focus on the blood donation house. This picture here the first blood donation house established by Biomedical this year. And from this year, local government has updated the public document Qingdao Demonstration Implementation Outline 2020. In the new plan, it points out that there will be 20 sets of such blood collection facilities implemented in 10 major communities across the cities. And the target for this plan is to ensure 1 blood collection facilities per 500,000 people, thus ensure the blood safety within the community and also avoiding any shortage in the future. And this picture down here was taken in 2008 while the Wenchuan earthquake has just taken place. It was the largest earthquake that ever happened in China. 69,000 people lost their life and 40 million people's life were affected by this disaster. And this just shows a scene that outside a blood donation facility in a near city that people who were lining up to donate their blood. So you can see that having such a facility in place will not only prevent the blood shortage during peaceful time, but also ensure when there's an emergency event, people know where to donate their blood and relieve pressure from public health management. And based on our research, we summarized the key points that users are most concerned. For example, efficiency. Such a facility has to be deployed as quickly and as easily as possible. Thus, the blood donation house will be designed as prefabricated. So production can be finished within a month and very easy for local installation and maintenance. And another concern will be the shelf life of the facility. So to solve that, we use environmental friendly insulation material with heavy duty outer materials to ensure the shelf life can be at least 20 years of operation. Therefore, significantly reduce the total cost of the facility. The last one is customization. The need from different countries and clients always have different preference. It is our duty to make sure the solution we provided meets the user's expectation and solve their actual problems. According to the study from Lancet Commission, the total number of global surgery in 2030 will reach to 330 million times. And among them, only 6% will take place in emerging economies. However, that represents the 1/3 world population. From a blood and plasma collection rate perspective, to explain this figure here, today's collection rate in middle and low income countries only meets a half demand of what is actually needed. Therefore, it is a trend that government will pay more attention on this issue and driving more resources to increase blood donation rate. And from a manufacturer point of view, will ensure that we can provide a one-stop solution to users when there's a need. And in order to do that, we have extended our sourcing pool to related business. Equipments and consumables, and also system, etc. If you please drop us an email to find out more details, and that's basically my presentation for the 330. Thank you, Peter.
You can stay in. I'm going to keep Ian here, and I want Enrique to come around as well, and Robin. So I've got 5 or 6 questions here that I want to get to in a moment. But thank you, Ian. I think what's very important here is that you showed real life and actual stories. and successful stories. And Haier Biomedical, as I mentioned earlier, will continue to build and create life-saving solutions, including our blood network. Okay. So, and a very good point was that manufacturing to your needs is something we provide. And again, if you get time to go to our website, go to and do a virtual tour, and you get to see on the virtual tour, or again, contact the team. So now I have a few questions, which I'm going to throw the first one to Robin.
Okay.
Robin's first.
Okay.
Slide in there. Okay. The refrigerated vehicle is it 4x4? Is it a 4-wheel drive?
Yes. Yeah, what we offer to the Uzbekistan is 4-wheel drive. Yeah.
Okay.
Correct. Yeah.
And does the vehicle come in different sizes?
We can design according to your specific requirements. You can offer customized products. Yeah, of course.
So I'll let you off the hook. So I'll just be clear. So the products are 4x4, so 4-wheel drive, and they come in different sizes. So that's something we can provide. Thank you, Robin. The next one I'm gonna give to Enrique. Enrique.
All right, Peter.
Your turn. Come closer.
Yeah, please.
Do you have a service partner in Nigeria to install the solar clinics or solar labs?
Okay, I think it's a very challenging question, but actually we have service partners in Nigeria, and it is only one highlight within our service network. We already built the service partners in more than 70 countries for the projects for United Nations as well, the government projects. So for service part, this can be provided.
Okay, thank you.
Not in Nigeria, but also some other countries,
okay.
Of course.
Don't go away. So today's PPT, since you're the boss, is this available to after the webinar?
Sure. So
how do they get that?
Oh, our marketing team has sent a link, and if you click link, and you can leave your email address there, and our marketing team will send the presentation to the email address you have left here.
So we'll get Lily to continue putting up that link so that you can join that, register, and get today's details, as well as find out all other things from Enrique's team.
Sure.
I've got you. Don't go away. I'll come back to you. So Ian, I'll move things around a little bit here.
When we're looking for manufacturers for chassis or buses, we always prioritize the local service capabilities. So in Pakistan, of course, and also in every other countries, we are able to provide this service, because, as you know, the vehicle is not similar to other products. It requires. I hope that answers you.
Okay, thank you. And the next one, I think we've got a bit of a double up, but who shall I contact for inquiries? Who's the main? So people will be able to register today through that link to find out more details. But who is the main person to contact for inquiries?
For inquiries, you can also to leave your email address here, and there will be follow up from our team and also marketing team. And once we get linked, you can get the information from either team, marketing team or sales team. But also, we also welcome to receive your inquiries on our website. There will be the sales manager responsible for different regions to answer the inquiries.
Okay, I think this next question I'm going to take.
All right.
So I'll take one for myself, from one of my marketing team. So basically, the questions come through. So how do I get an invitation for future webinars? So by registering today, we'll be able to get more of your details. By scanning the LinkedIn QR code, you'll be able to get see what's happening a few times a week. We put several stories, case studies, new products, new solutions are regularly put up on LinkedIn. So we encourage you to join our LinkedIn account. We are on Facebook, same stories will go there, but we encourage you as a business platform to join LinkedIn. So please scan that. I'll keep it on the screen for another 30 seconds. And then, as I said, make sure you also register with the link that Lily is putting into the system as well. Okay. But what I want to touch on is that we're going to do some things a little bit different. Enrique's team are very active in doing regular webinars with both the French and English Africa distributors. But next year we're going to do a little bit something different. We're going to start on the 18th of January. We'll be doing our annual company review. So our leaders, and including Enrique and myself, will be part of that review on the 18th of January, where we'll do a full overview of the whole company that happened in 2021, including what our plans are into 2022. Okay, so on that will be on the 18th of January, and you'll receive future information about that. But what we're a bit excited about is our Think Tank Thursdays. We will get to March, where we'll be running first Thursday and third Thursday of every month. But to start with, in January, we'll be under the banner of Think Tank Thursday, but under our Higher Biomedical web channel, which we're introducing into 2022, is that we'll start with training sessions on the 20th of January, the 17th of February, and then, as I said, the first and Thursdays of every month. That's the first and third Thursdays of every month will be Think Tank Thursdays, where we'll be running training and other information about new products, solutions, current products. And we're happy to listen to our distributors and attendees from today if you have anything as we move into the second quarter next year. And to find out more, the QR code will help you get there. Okay, so that's a little bit about some webinars next year. The first one will be on the 18th of January with an overview of the whole company from 2021 as we move into 2022, and then followed by some training sessions on Thursdays as we head into it. So in wrapping up, big thank you to Enrique and his team, and to Dr. Chetty, thank you so much for your time today, but really a big thank you to you all for spending your precious time with us to listen to us, and we appreciate that very much. And we also thank you for your patience in the beginning with a little bit of technical problems, but I think we all understand that this happens time to time. So again, to find out more, contact us through what I mentioned, social media, email, etc., or through today's link. So from the entire team, we wish you a safe and prosperous festive season, and we look forward to working together with you and your teams in 2022 to continue together to solve the needs of all through effective, innovative, and technologically advanced biomedical solutions to the last mile. And as the leading cold chain supplier in the world, we look forward to continuing that into 2022 and beyond with our key partners. And to everyone that is here today, we've got other expansion happening around the world into Europe and the US. So we look forward to bringing you more about our post-pandemic strategy. And obviously, today's Hiclinic was very much part of our post-pandemic and to solve the problems of last mile health around the world. So thank you very much. I think that's it from our end. I'll just look around the room to see if anything's been missed. As again, here's the code. So thank you very, very much, and we wish you a good afternoon and a very good week and festive season. So from the entire Higher Biomedical team, stay safe and thank you very much. We'll see you next time.